Hello and welcome. Uncharted territory. That's where British Health Secretary Sajid Javid says the UK is now entering as it moves to lift legal restrictions aimed at controlling the spread of COVID-19. Masks are to become optional. Social distancing will end in England in 2 weeks' time. Mr. Javid says that case numbers could be as high as 100,000 a day by the time the changes come in. But he told the BBC the effectiveness of the vaccination campaign means they can go ahead.
The reason we can now do this is because of the huge wall of defence that's been built by the vaccines. We've got the most successful vaccine rollout programme in the world, and we are seeing increasing evidence, very compelling evidence of the link between case numbers and hospitalisation and deaths severely weakening. And because of that, we can now afford to make these changes and start to find a way to live with COVID. And now, just to be clear, no one is pretending the pandemic is gone. The pandemic is still very much there. We are still in a pandemic. Case numbers are high, and they are going to get higher. But the difference is that this vaccine wall of defence, it is working, and the link between cases and hospitalisation is severely weakened.
Well, no country in the world has attempted to lift restrictions, as the UK plans to, in the face of rapidly rising cases caused by the Delta variant. 63% of people in the UK are fully vaccinated, but over 27,000 cases were reported on Monday, over 90% of which are driven by Delta. France does fear a fourth wave of the virus too because of Delta, which accounts for around a third of all new infections. It's delayed some of the lifting of its restrictions after seeing a surge of cases. In the US, Anthony Fauci has warned there will soon be surges in cases of Delta in areas where vaccination rates are low. Almost 60% of Americans are fully vaccinated. That rate, though, varies sharply by region. In some places like LA County, well, they've already begun recommending that vaccinated people wear masks again. And in Asia, many countries are battling a surge also related to Delta. Indonesia imposed a partial lockdown on Saturday, reporting almost 30,000 cases in one day on Monday. Well, let's bring you more on the situation here in the UK. Here's Damien Grammaticus.
Will hospitals be able to cope? It's a risk the Prime Minister is contemplating taking. His desire is to remove all COVID restrictions across England, just as infections are rising fast again. But Boris Johnson believes relaxing curbs now in the summer is preferable. Waiting could be worse.
We'd run the risk of either opening up at a very difficult time when the virus has an edge, has an advantage in the colder months, or again putting everything off to next year. So I do think it's going to be a very balanced decision.
What he envisages is no more social distancing, no limits on how many can visit your home, or how many can pack restaurants, bars and pubs, theatres, nightclubs, sports stadiums, all open and full. No more empty offices, as the requirement to work from home would end too. But there's a concern a third wave of COVID is underway, with an average of more than 25,000 cases a day in the past week, and the number infected is doubling roughly every 9 days.
No, I think that's
His own chief scientific advisor said now is the time to be controlling the virus.
We are in the face of an increasing epidemic at the moment, and therefore we need to behave accordingly in terms of trying to limit transmission spread.
But the vaccination programme is blunting the pandemic. The numbers in hospital and dying with COVID are relatively low. It's the reason Mr. Johnson believes he can go ahead. And he wants to remove the legal obligation to wear a mask too, though the scientists are cautious, saying they will continue to wear theirs.
There was a really clear consensus that under all circumstances some degree of further social distancing will be need to be maintained even after the restrictions are lifted in law, and that's been part of the roadmap all the way through, and that is widely supported by the scientific views.
And today we'll hear more about the plans for schools. Here too, the government is hoping to lift restrictions to put an end to bubbles and isolation of whole groups. Judging the cost is no longer worth the benefit. Damien Grammaticus, BBC News.
Let's talk now to Alison Pollock, who is Professor of Clinical Public Health at Newcastle University. Alison, good to see you. This is obviously a political issue, a very emotional issue for people as well, the lifting of restrictions like this. And it feels like the whole world is watching to see what happens here. What are your thoughts? Is this a good idea or too much of a gamble?
I think the first thing to say is that many countries have already removed many of the restrictions on movement and social distancing and masking to a greater or lesser extent. So the UK's decision to move this way isn't really unique at all. So while many countries have kept a few measures in place, many measures have gone in many countries.
But just to interrupt, Alison, and to clarify, isn't it unique to be doing this at a time when we are seeing such a rise in cases, possibly 100,000 new infections a day once these restrictions are lifted?
I'm not so sure, because the scientific advice, there are two issues. The first is that we are seeing a clear break in the link between hospitalizations and deaths. Deaths are actually lower than the 5-year average at the moment. That's all deaths. So things are looking pretty good. And we should really be able to cope. We've got very high vaccination rates in people over 40. And these are the groups that are most at risk as you get older. So we're looking at very high vaccination rates. And we're not seeing cases translate into hospitalizations. But the real issue, I think, is that the government at the moment is putting all its eggs into the vaccination basket. But it really needs to remedy all the structural weaknesses that left us so vulnerable in the first place at the start of the epidemic. And that means doing a number of things. It means rebuilding the capacity in our public health systems and our hospitals as well, addressing the structural weaknesses which left the poor and the elderly so vulnerable, and that's structural and systemic, and also stopping doing wasteful interventions such as mass testing, especially the mass testing in schools that have no evaluations to support them whatsoever.
Why has mass testing not worked here in the UK when test, trace and isolate has been so successful in places like South Korea?
So the key difference is that the government at the outset of the pandemic in the UK took testing out of the clinical service. Now these tests really should be used on people with clinical symptoms, and then you try and isolate and follow up the contacts and even test the contacts. But the government put testing into the community self-testing, and we know that that's been a disaster. The government has spent over £2 billion on mass testing, lateral flow tests, with no results and no evaluations of self-testing in schools. But we know it's doing enormous harm, with over 300,000 children having to isolate from school on the basis of tests. And these tests are not very reliable. They generate both false positives and false negatives, and they can be contaminated, as we've seen, by children dipping them in orange juice or Coca-Cola. And indeed, it's important to say that the FDA in the US has said that these lateral flow tests should be put into the trash. So we've spent a lot of money on mass testing, and what we need to do is to put testing back with clinical symptoms into the health system and to stop privatising and outsourcing the testing.
Professor Alison Pollock, good to get your thoughts. Thank you so much for joining us.